Hi, I'm Piera,
And I'm Harley.
and we're casually.
Mental.
Yay! We have a guest.
We do.
Hi.
It's Mary. Mary is one of my really good friends from college, and she actually was on my first whole mental health thing that I used to do because she gives really good background on how to find a therapist and all of that stuff. But Mary, I will let you take it away and introduce yourself.
Yeah. So, hi, my name's Mary. I'm a social worker in New York City. I primarily do hospital social work, and I've also practiced as a psychotherapist. My specialty is actually in end of life and palliative care. So, I have more experience or the most experience within things like narrative therapy and meaning centered therapies.
Yes, we love a
Welcome.
therapy
Yay.
queen. So, Mary, we wanted to have you on because we get a lot of questions about just like exactly so like how to find the right therapist, how to know when to get into therapy, like and all of that fun stuff. And so I guess to just kick it off right first and foremost, I know that you have a whole spiel that you like to give. So
I'll have the floor. Okay, so so assessing for psychological or psychological support and assessing for support for patients is something I do in the hospital a lot, and I connect them to mental health providers in the community. I thought a good place to start would be, what is a therapist? A therapist is short for psychotherapist, same thing. You'll see a couple of different disciplines within the therapist role. So I'm a social worker. Social workers can be a therapist. You can see it listed as LMSW or LCSW. There's also psychologists and counselors. Now, depending on what they specialize in, each therapist is different. But in general, they're all trained in talk therapy. On the other hand, a psychiatrist is not necessarily trained in talk therapy. They're really more trained in the chemistry of the brain. They're doctors. They're the only ones who are able to prescribe medication, and they're the only ones who need a referral from a primary care provider in order to see one. So, in general, if you want your insurance to cover talk therapy with a counselor, social worker, or psychologist, you don't need a referral. If you feel like you need some medication, then you would need a referral from a doctor, and you could seek a psychiatrist that way. But I wouldn't anticipate them to be able to talk about your needs. And furthermore, with medication, what I always say is medication can turn down the dial of your symptoms. For example, if your anxiety is on a 10, the medication can bring down the dial on it, but you're still going to have your feelings. And my suggestion is you really should have the talk therapy alongside that to know what to do with those residual feelings. Yeah, and you want to have your feelings, right? It's okay to have anxiety. You just don't want it to overcome you and be unmanageable and not and keeping you from going about your life.
Hmm.
yeah, there was definitely
Uh,
a point where like I I like refused medication for a really long time. So I really love that you say that because I had tried a few different ones and like I I hated them. Like I think I tried like Prozac, Lexapro, all of them because I had really bad anxiety. And I just it kept on like not making me feel right. And so I kind of gave up. And then when I started getting kind of bad again, I finally tried this one called Celexa, and it really worked for me. And it's kind of insane because I think I was always really anti-medication for a really long time because I thought it was going to like change who I was. And I realized like after trying a few different ones and actually trying the like getting Celexa, like I'm still on it today. And obviously I do talk therapy. So I have both a psychiatrist and a therapist. But I do have to say, like, and I'm on like a not extremely high dose of Celexa, but I do have to say, like, when I used to not be on it, like I was consistently anxious all the time. Like now I still get anxious, but it's definitely like more manageable. And so I do know there's a ton of people out there that are like anti-medication. And like just to add on to your point, like I think it's about testing which ones actually make you feel still like who you are. So it's not just like, oh, my doctor prescribed me Lexapro, one and done, that's it. I was even like Buspar for a second. I hated it and like went back to Celexa. So it's like, I think it's just all about figuring out like what makes you feel okay. Like, am I correct in that? Or I don't know if that's something that's normal for like
Yeah.
you hear that too, Mary.
Like, yeah, I mean, and you're also throughout time, like your body adjusts to certain medications. So you may need adjustments as needed. When a medication works for you, it doesn't take away your feelings. It just turns down the dial so that you're able to work through whatever it is in an adaptive way. When it's not doing what it's supposed to do when you don't have anything, when you have a very blunted experience.
Yeah.
And, to piggyback off that, that's life, right? Like you're going to have new trials and tribulations, and depending on your experiences or what's happening, you're going to have different reactions to that. And the talk therapist is really going to be able to help guide you through those experiences. Um, I can move on to the meat of of the content, which is
Let's
where
get to the
can you
meat.
find this person?
Yes.
Um, so there's a bunch of places. So the most affordable for most people is through insurance. I will say if you don't have insurance, look into getting Medicaid. Medicaid is done through the state. If you have Medicaid in Tennessee, it will not work in Alabama. So you have to re-enroll in Medicaid in each state. And that means you have to disenroll another one. It's a mess. But anyway, go to Department of Health. Most states have just an online application. And it's my cat's playing with the leaf in the background.
Let's
I
talk
love
about
it. The
therapy and
cat's into
cats.
it.
Oh,
Is
cats are sick.
cat
There,
therapy?
there's data that like the purring of the cat, like actually like because it lowers your heart rate and it reduces anxiety. There's data. Animals are very
Ooh.
therapeutic. So
So
you could also
if I go to a cat cafe, does that count as therapy?
it could I say anything therapeutic is therapy. That could be
Not no.
laughing, self care, anything therapeutic is therapy. That's my own
I'm all
perspective.
about my spa life. My Korean spas are my therapy, so I get it.
Yeah, therapy. Um, and if you want a human to talk to you as therapy, lots of ways. So one thing, Medicaid, you can just go to your state's Department of Health, get more information, call the number there, find the Medicaid application. Um, and so that's one thing, just the insurance piece. And then if you already have insurance, there's some nonprofits you can look into, like NAMI, NAMI, Mental Health America affiliate. There's something called SAMHSA for addiction. There's NEDA for eating disorders. NA. So depending on what you got going on, there's usually a nonprofit that can address it. There's even nonprofits. There's a nonprofit for anxiety and depression. There's nonprofits for certain diagnoses. I would go onto their website, look at the mental health. They usually have a list of mental health providers, or a lot of them have like hotlines, like or chats. You can like ask, and they can like help you, and see what providers they have, and their providers would be specialized in that certain area, and call them and see if they take your insurance. Another piece, if they don't take insurance, usually they have there's a sliding scale. Most therapists do, but that's still, I would say, gonna run you I mean, if we're being realistic about how much therapy costs, I mean, on a sliding scale, like 70, $80 is like pretty normal for the low end of what someone would give you on a sliding scale. If you get someone very generous, maybe like $60, $50, depending on your area, but I almost never see that. Usually like 70, 80. But yeah, that's for like a sliding scale.
One of the things that
No,
we've talked about sliding scales before, and one of the things that people always ask is like, how do you get a sliding scale? Like, because obviously like therapists have a cost, and how would you ask for that like sliding scale if you were somebody that didn't know how?
you literally just ask. You say, "Hi, I'm looking for a therapist. Do you have a sliding scale?" And you don't know until you ask.
So simple,
That's
so true.
just
See,
ask.
I'd be too scared to ask, but I like that that's how you start the conversation is literally, do you have a sliding scale? Yes or no? Like the worst they can say is no.
Yeah, I
Bargain
think.
with your
I mean,
therapist.
well, also you have to think about it. Like this is a business transaction, right? Like when you go to the car dealership, like they tell you to negotiate, right? This is the same thing. Like even though therapy does have an emotional element, this is also a business transaction. Don't be shy. This person wants your business, and they also want to it, you know, and even though they also want to be a support for you, they also want your business, and it's okay to be transparent about that, and talk about the cost, because it is a business too,
Capitalism.
which may not be yeah, I mean, it's just and I know a lot of people get a little bit uncomfortable with that, but it's true, and and that's what I'm saying. And you should that's why when people talk about being shy about talking about your therapist, you're paying. This is we work for you, right? The therapist works for the client. The client does not work for the therapist. So that's
I
something
like
to
that.
keep in mind. Uh,
Put it on a billboard.
yeah, we work for you. Another way is like just one of these like search engines, like a Psychology Today or I found another one, Theravive. But those, I feel like people kind of just like they specialize in everything and take insurance, and they don't. So you have to follow up, and it's a good place to start. You just reach out. Um, Another great place is a primary care doctor, or like any other doctor. Like for example, if you see a specialist at Mount Sinai, usually they have a list of mental health providers, and it's helpful because if your insurance is taken by Mount Sinai, they typically have providers who also are in network with that insurance. They wouldn't typically give you a list that would be outside or out of network. Um, Another place is the State Department of Health. Typically, there is, again, like you can do like little chats, and they can help you get connected. Um, Other ways, your insurance company's website. So if you go to the insurance company, you can find like in-network providers. And the other way is your coworkers. If you get insurance through through your work, then you can if you feel comfortable, talk to your coworkers. Say like, are you like, if you like, are you in there, or if you've already talked about going to therapy, ask them like who their therapist is. If they're part of like a group, for example, you could see if someone else is available within that group and if they take your insurance. And I would say those are the main ways in which to find a therapist. I've said a lot. Thoughts,
I guess,
feelings?
yeah,
Yeah, this is
well,
great information because I had no idea
yeah, I think
where to
another
start.
question that I have too, because I know there's like BetterHelp and stuff. Like, what do you think of those places online?
Yeah, so BetterHelp is another, if you're bringing that up. So there's like Talkspace and BetterHelp. Those are other avenues through which you can find a mental health provider. Usually they take insurance. If not, they can figure out a sliding scale for you. Thank you, Harley. I forgot about that one.
Whenever someone comes to me, they're always like, how do I find a therapist? I'm always like, I don't know, just go to BetterHelp, because it's like the one that's always like ringing in my head, because they do a really good job at advertising themselves. But
They
like, for instance,
do.
like exactly like what you said, like I found my therapist that I go to now because I'm with Kaiser, and I talked to my healthcare provider, and that's how I got my therapist, was through that, who also works on a sliding scale. So for me, like that whole process was pretty easy, but I know for other people it's not as easy. And so I always just get so curious about like BetterHelp, because I know a ton of people do it, and I know a ton of people, like one of the things that they always talk about is how like they don't always like their first ones that they find. And I'm always like, well, you kind of keep going, because like you can't just try like two off of BetterHelp and then think like, okay, it's done. It's like speed dating in a way.
Well, I like going back to like trying medications, like some may not work for you. I mean, that's the same with therapists. Like you gotta vibe. Like you and your therapist have to vibe. Like it's like dating, right? You go sometimes you need to have chemistries. You either have chemistry or you don't. And you can't fake it, you can't fabricate it. Um, and in my own opinion, I think the best therapist is beyond, it's like, is someone who can be really in tune with you beyond their training, right? For me, I feel like no matter how much training they have, if they're not able to be receptive to how their client is feeling, if you say something and it's not hitting, or maybe knowing when to push or when to pull back, I feel like the best therapist is going to be most adept at that beyond whatever they're specializing in.
Yeah, it's interesting because I didn't like my first therapist, and I kind of thought she was like a little judgy, and that's actually one of the questions we got when we asked our community is like, how do you share and not feel like you're being judged to your therapist? Like, are they
We got
secretly
a few
judging us or
questions.
no?
Yeah, we got some like about like
Yeah,
if we do drugs and we talk about drug experiences, like are our therapist judging us? Which I think is funny, because it's like, I mean, like drugs, alcohol, weird sexual behavior. That was weirdly a lot of my friends asked that. So, uh, uh, anyways.
I mean, here's the thing is that like I can't speak for every therapist because there are bad therapists out there. A bad therapist is will judge you. A good therapist is not going to, you know? So if you have a rapport and you feel like you're being judged, sometimes I would, I mean, now this is being the role of a therapist. Sometimes the content is the process is the content, is what we say. So why are you feeling like you're being judged? Is it reality, or is it a feeling that is it reflecting on something happening on you? Or are you judging yourself and you're projecting that onto your therapist? So that's another thing too to be considerate of. And in those instances, I encourage them to say, I feel like you're judging me. Because that can bring up really, really like maybe beneficial content for the session. Uh, but I would also say, depending on the situation and what's going on, trust your instincts. Maybe your therapist isn't right for you and they aren't creating a safe space for you. Um, Also, another note about like drug use or like, I don't even know, like illegal activity or whatever. I mean, as far as like maybe your therapist will, you know, as long as safety is our number one concern, right? So like maybe there might be some concern for safety and we're not allowed to like do anything about it. So I will also say, just like from like if you're worried about that, like we're not allowed to do anything. But as far as the judgment piece, I mean, it could be a couple of different things. It could be your instincts and that are correct, and that maybe this is the therapist for you. They're not creating a safe space. It could be a reflection of some sort of internal strife or a judgment you're projecting onto them. Or it could be fear for safety, right? You're fearing that they may retaliate or like report you or something. I'm not sure if that is what people are reflecting on, but it could be a couple of different things. Depending on how comfortable with, it might be something you could share with your therapist and see if they're able to help you. And if not, maybe it's time to find a new therapist.
I mean, for sure. Pira, I know that you had some good questions from some of your friends. What do you
Yes.
want to jump into the second question, I guess, since we already just naturally got into the first one?
Yeah, our community here. Yeah, so I mean there's a lot of really great questions. We're obviously not going to say anybody's name for any of these. But how somebody asked, are there any caveats with therapy? Like is it counterintuitive or counterproductive to bring up trauma?
It depends on the individual. But I know my cat is meowing. I know Zaytun. It's hard. But I hear from my understanding of that question is sometimes talking about things that you think you've healed and you talk about them again and it reopens old wounds. And that can happen. But the thing about like when you open a wound, there's still opportunity for repair, right? There's always going to be rupture and repair throughout life. Whether you find that you could have lived without that rupture and maybe the repair is taking, you're finding that each time you rupture, you're not able to repair again as well as you did before. I think it's something you have to be really honest with yourself about what's going on and why did you bring it up in the first place. Maybe if it's something that you naturally brought up, maybe there's a reason to that, right? An unconscious reason that maybe you wanted to revisit it. And if you're still feeling so ruptured by bringing up these old wounds, maybe it is something that didn't repair fully in the past. So that's something to think about too, right? Like, why is it so painful for you to bring it up again? Maybe that could mean it didn't fully heal in the past. So really thinking about, the experience of talking about your life can also be part of the therapeutic process. So counterintuitive, in general, I'm going to say for the most part, no. If it's painful to do it, there's a reason for that, and that might be something to look into with your therapist.
My microphone, just so everyone knows, is always on lag. I don't know why, but it's always on lag for me. And so it always messes up everybody else's talking stance points. But I feel like me and Piera, once I say this, I feel like you're going to be like, that's exactly what I was about to ask too. But one of the questions we always get to is like, because me and Pierre always talk about how we're an EMDR and it's really helped us through like past trauma. Yep. See, I knew we were going to ask the same one. But a lot of people for me, I always say like, do talk therapy first. And like through talk therapy, I like found a group to talk to, or through talk therapy, like I started EMDR, which helped me kind of look more into my trauma. But like, I know some people like just want to go straight into EMDR, or some people want to go straight into, there's so many different kinds of therapy. Like, how do you figure out which one is right for you? Is that what you're going to ask, Piera?
Literally, that's one of the questions. Like, how do you know what kind of specialty to go into? So yes, same
Great
wavelength.
minds. Great minds.
So there's a million different types of therapies. I'll say that like most people will, I'll name a few that might be like really, you might see pretty commonly. So like CBT is like the number one therapy. Like pretty much every therapist now has some sort of CBT training. And that is, it's a, I mean, it's really regimented at its core. It's really like going to school. So you can have like training in it, but not follow the like exact guidelines. But it's helpful. It just helps you connect between your thoughts, behaviors, and your actions. Like pretty just helpful. If you feel like you're going about your day and you are unhappy in your life, but you have high functionality or medium to high functionality, then something like that would be good for you. If you're feeling like your symptoms are inhibiting you from performing activities of daily life, of going to work, spending time with friends, then you would say like you're not as functional, low functionality, and then you would need maybe more trauma centered therapies. Like the EMDR is a more trauma focused therapy, and the more trauma focused therapies are about creating safety. So it helps separate your memories of the experience and your physical experience from each other. So what it is it helps reorient you to present time and place and create a sense of safety through that, assuming that because you're typically in like a safe place at the present. When you're thinking about something unsafe in the past, it creates an unsafe place in the present, even though that's not the situation. I feel like is this making sense?
Yeah, this
Yeah,
is
I
helpful
guess
because I only knew about talk therapy.
yeah, well, that's what was even going to be my
Yeah,
question is the first one you talked about. Like, I don't even know what that is. Like, can you explain what it is?
CBT. So it's cognition. I don't even CBT. So it's kind of behavioral therapy. So you have your cognitions, you have your behaviors, and then you have like your actions. Like I said, CBT is I think the most used therapy today. Basically, like when you hear things about trying to think of something like I just said something projecting. You have cognitive distortions where you, for example, like fatalize, like things like that you might have heard. That actually comes from CBT. Um, it's just it looks into you do reality testing then, right? Like, is this my feeling or is this reality? So there's different. It really focuses on how your thoughts relate to your feelings and how it affects your behaviors and kind of the relationship between that loop. So for example, is there a negative thinking pattern that we can change in order to reduce a negative or maladaptive behavioral pattern? It, and if you're doing it like strictly how it's done, there's like literally like week 1 you do this, we exercise, week 2 you do that exercise, there's homework and you like have to follow up. It's also mindfulness is a big part of that. But yeah, each therapist is going to be different. For example, me as a therapist, homework is against my religion because I'm not doing homework. I don't do homework. It's just not a thing for me. Like I'll do like maybe like think about this during the week, but like I'm never gonna be like complete this worksheet and give it to me on Monday. I don't know. That's just not my vibe. But like again, see a real CBT therapist will be like complete this worksheet and give it to me on Monday.
Oh wow. Yeah, I like homework. I asked my therapist for homework.
Yeah,
Maybe
everyone's different.
therapy for you.
That's what I'm saying. Yeah, it's
Yeah.
different. I think different therapists are better suited for, it's about the vibe, right? Like me, that's not how I operate because I don't want to do homework and I don't want, and like for me, like with my therapist, whenever my therapist gives me homework, I'm like, I'm not doing that. I work
I don't
enough.
do
Yeah. I remember the first time I asked for homework and then I didn't do it. And then
Yeah.
I don't know, it reminded me of school where you forget to do the thing. And I was like, I didn't do it. And she's like, that's okay. And I was like, oh, okay. It's like, this is therapy. I pay for this. Like, it's fine.
I
Exactly,
guess
right? We work for you.
Another thing too though is like because there's so many different like so like obviously there's like EMDR the one we're talking about, but like for instance even like there's like AA and like all those other ones out there too like is there I guess is there like a process to like figure out which one, you know what I mean? Like I feel like I'm explaining this question really bad. So
Which
hopefully
one's
you
best
understand
for
Yeah,
what I'm
you?
saying. Yeah.
yeah, yeah. I mean, what I would say is I would, because there's so many, like for me to explain it all here, I think would take like a really long time. What I honestly think to do is literally Google like what are the best therapy for your specific, what you think your diagnosis is, and see what comes up. Um, I will say that like off the bat, for example, I things like I'm looking for. I'll say off the bat, like DBT is good for borderline personality disorder. CBT is good for anxiety and depression. EMDR is good for PTSD. So those are some big ones to name. I will also caveat that like the addiction big book, it's hard. I don't want to call it it's not really, I don't want to say it's like, I wouldn't technically call it therapy. Because while you're doing it in a group setting, it's not led by a clinician. It's I don't even know what I would call it. But you do follow, there is like a big book and you do like therapeutic work, which I just said earlier is therapy, but I wouldn't even call that like ther- a therapy style. Um, but it does have therapeutic elements. So honestly, I would just look it up. And then a caveat to all of this, I truly feel that no matter I wouldn't get too bogged down by the training because no matter the training, your best therapist is going to be able to vibe with you. I think I would, because even if you find someone who is trained in a specific specialty that treats your specific diagnosis, if you don't have a connection with your therapist, you're not going to get a productive session or productive therapeutic environment from it.
Yeah. That brings up we got another question that was kind of like relates to this of when you figure out that maybe your therapist isn't for you. They asked, how do you break up with a therapist and what while you're trying to get better at confrontation?
When
Which yeah, like you're trying to get better at confrontation and you want to break up with your therapist, but like you're literally going to your therapist to help you with
Ghost your
this.
therapist. I'm just kidding. Don't ghost your therapist.
you, be honest, send an email. You could just send an email. You don't have to go
No.
to the session. You can just send an email. Um, is that getting better at confrontation? I'm not sure. I mean, you are confronting them just via email, which can be less intimidating than face to face. I think I almost feel like those are two separate. How do I get better at confrontation? How do I break up with my therapist?
Yeah, I guess for people who are good with confrontation in general, I guess how do you break up with a therapist? Are you just like, okay, I think this is my last session? Like when my last EMDR session, she didn't break up with me, but she was like, we went through the things, and I was just like, oh, okay, we're good. Versus my first therapist that I did not like, it was we kind of were both like, do you want to book your next session? And I was like, no, I'll email you. And like, that's how it ceased. So I don't know if it like naturally happens or if there's like a standard like copy paste thing people could keep in mind.
I'm telling you, as a therapist, we're used to people just ghosting us, not showing up, doing things last minute. Like, we love when people consider our time and like if you send me an email a week before our last session, I'm like, wow, what a respectful person. That's from like a therapist perspective. If I think someone sends me an email a week before our schedule or whatever, not even a week, 2 days, a day before just before our scheduled session. I'm like, respectful. You don't have to do much.
That's
so
great to
funny.
know. That everybody just email.
Yeah, send an email before your scheduled session so I know that you're not there. You're not going to be there. I'm not.
That's so
Ever?
funny. Good.
Yeah,
Like,
I'm
I
not
feel
stood up.
like therapy is like so much like dating. Like, you gotta find somebody that clicks. Like, sometimes you like send a text or you ghost, you know what I mean? Like, there's so many similarities. Except for dating is
So much like,
worse.
and
Yeah.
well, hopefully you're also not physical. But yeah,
Fair.
but yeah, therapy is so much like, and sometimes too, you could have a therapist for a year and and you could have like a really good year and then feel like they're not doing it for you anymore and it's time to break up. It's like dating, right? Like, oh, I need someone new. I need a new perspective. And I think that's healthy.
Yeah. Do you have any Harley
One
questions?
more. Yeah, I have one more that I think is something that could really benefit everybody. And I think is maybe this would be like the good question to end on. But I think a lot of people that talk to me about things is like, how do I love myself? Right. And like they put a lot of stress on like how to love myself. And, for me, like I always struggled with that too, because like I really hated myself for like a really long time. And to be honest, like going to therapy definitely helped me to kind of find that like inner peace. So as like somebody struggling to like love themselves and like really find peace with themselves, like what is your best advice coming from, your side of the field?
From my side of the field, you mentioned inner peace, and I think that maybe a shift in perspective might be helpful, and that not everyone has to love themselves. And maybe at this time, that's an unrealistic goal, right? Like maybe creating a shorter, more realistic goal, maybe creating neutrality towards yourself is more realistic for you. And also being honest that you're never, even the most stable therapized person in the world, you're not going to love yourself at all times. It's okay. It's okay to not be okay. It's okay to be disappointed in yourself. Um, you don't have to love yourself at all times. Or maybe even loving yourself is not a realistic goal for you. Maybe the goal should be shifted to neutrality. Another way to maybe move toward your goal of self-love, if you feel like that's a realistic place for you to reach, is creating more boundaries about what is my fault and what is in my control and what is not in my control. For example, like we can absorb a lot of negative experiences and take responsibility for them when they're not our fault. So creating space around, what's my responsibility, what I should take on and take ownership of, and what was out of my control, and maybe, did I react based on a circumstance that was, really hard and that I had no control over, and not being so hard on ourselves about what that reaction might have been because we were put in, really hard circumstances, being gentle with ourselves through our experiences, and giving you space to make mistakes.
I like that a
And
lot.
that's
Yes.
Amazing. Well, thank you so much for sharing so much knowledge that even me and Piera had no idea about. You taught me each time we've had these conversations, you like taught me more and more each time. So I appreciate you.
I'm glad. I felt like I was rambling.
No. No, this is so much great information. I like, and anyone listening, like I'm sure it's going to help them in some sort of way, especially with the body neutrality, and I mean, I feel like there's such high expectations to love yourself and be like confident, and that sometimes doesn't need to be the goal. So that's really refreshing to hear.
I neutral myself.
Yeah.
Well, thank you so much. This is
Thank you
amazing
for
to
having.
listen through. Yeah. So I don't know, thanks for listening, everybody. I hope you take it easy and give yourself some grace. I don't know. How do y'all want to wrap this up? I'm like ready to Google search all the things that you just said.
Honestly.
Get Googling. Bye. I neutral myself.